Hi, this is Rick Basinski, Chief Economist at IBISWorld. Today, like my last 5 webinars, I'll focus on the labor market and the recent unprecedented spike in unemployment. This is episode 13 of this series in which I investigate the ramifications of the COVID-19 crisis. This will be the final installment of the labor market theme. I'll move on to other related issues next week, so stay tuned. So today again, my motivation will be to identify employers that will rehire quickly against those that will fall behind, also which industry segments face longer term challenges. This should be useful for banks in assessing credit quality for both consumer and commercial lending, all tied to employment prospects, and hopefully provide some data and insights for non-banks as well. I thought it would be useful to provide a basic list of my labor market related webinars, episodes 8 through 12, and what I'll entertain today, episode 13. Since I've covered so many issues and industry groups, not to mention hundreds of individual industries, you might want to use this as an index if there is a particular line of business of interest to you, particularly if you missed any of my previous webinars. So take a look and save this. As a point of reference, here are the unemployment rates by sector this past May. Today I'll be covering employment in education, healthcare, and the information industry. I'll also take a close look at the management, administrative, and support services group, as there are notoriously many flashpoints here. I'll commence with education and healthcare employment. I always found this to be a rather curious aggregation, so I'll definitely disentangle this momentarily. On this chart, it's evident that although unemployment rates for education and healthcare track the overall rate closely, it is considerably and consistently lower than the national rate. This was even true during the recent spikes that I highlighted here in the rectangle. The gap was largest during the Great Recession and the snail-paced recovery that followed. This may lead one to erroneously conclude that this broad sector always provides a safe haven for lending. I'll dispense with this notion in what follows. In this table, I disaggregate, comparing unemployment rates from this May to a year earlier, and in the far right column, the percent erosion from 2019 to this year. Obviously, all have suffered from social distancing and non-essential business policies. However, this is a matter of degrees. Educational services have been battered, as have healthcare services involved in ambulatory or what many call outpatient care. Also, social assistance organizations got hammered. I'll get even more granular than this in subsequent slides. There's definitely a need to get more granular for any meaningful analysis of employment, so I'm going to drill down into 4 subgroups here. Education, that's NAICS 61 for those of you familiar with this genre of coding, and for the rest, being NAICS 62, hospitals, health services involving ambulatory care, and social assistance. Like last week's webinar, as an additional step, I'll employ IBISWorld's forward-looking industry risk ratings as found in our early warning system to help identify which industries are vulnerable and which are relatively safe over the next 12 to 18 months. Consider educational services. In this table, I calculated the average employment growth rates for both the 2009 through 2011 and 2012 through 2014 periods, representing the last cycle's recession and the early recovery stage. In the cells of this table, I colorized industry risk intensity, where red signifies high and green defines relatively safe bets. All of this derived from IBISWorld's risk scores, as I mentioned. As for the yellow cells, I'll have some cautionary remarks. Language instruction is red flagged largely because of ongoing restrictions on international travel and potential reluctance to go abroad by both consumers and businesses. As you can see from the employment growth figures, business certifications and IT schools suffered immeasurably in the last cycle, and the prognosis is not good this time around either. The yellow highlighted industries are deeply dependent on speedy reopenings, which in many cases aren't likely this calendar year. The best hope for schools that rely on tuition will come after the holidays, but even that is uncertain. Employment in sports coaching facilities are facing declining demand as discretionary spending withers and face-to-face interaction is limited. On the other hand, trade and technical schools look promising since, as you may recall from some of my previous webinars, there has been a shortage of skilled blue-collar workers even prior to the COVID-19 crisis. Within the hospital's nursing and residential care group, IBISWorld's industry risk ratings only red flag employment in orphanages and group homes. Nonetheless, there is a couple of areas worthy of discussion. Although nursing care facilities have been ravaged by the coronavirus, their revenue growth is expected to rise this year with the infusion of nearly $5 billion in relief funds directed towards skilled nursing facilities. And despite tragic fatalities, new regulations are in place. Plus, a growing elderly population should provide strong support for employment in this industry down the road. Hospitals, on the other hand, are being pinched by higher costs and lean revenues due to the coronavirus. The weight of outlays of expensive supplies and equipment has been a strain, and for many hospitals, revenue has suffered as both outpatient services and elective surgeries have been deemed non-essential. These are likely to be slow to recover. Nonetheless, the Department of Health and Human Services has distributed payments to selected hospitals with high COVID-19 admissions and some rural providers, which should keep the industry afloat and employment prospects generally solid. However, there are other more fundamental issues to consider. As you can see from this graphic, in the past 10 years, there have been many hospital closures. Since the pandemic, many closed hospitals have been reopened to help treat COVID-19 patients, but their medium-term fate is uncertain, even when some semblance of normalcy returns. One reason is the high incidence of M&A activity over the past decade, as you can see from this chart. Hospitals and health systems will continue to make deals in order to improve quality of care and, in particular, lower costs. This trend will not be stopped by the current crisis. Further details are available in a paper I wrote with Dev Strychek and Ken Kirby as attached to episode 7 of this series, available at IBISWorld's Industry Insider. This consolidation will hinder employment in non-practitioner areas, so maybe further consolidations are best referred to as administrative centralizations. Another issue is that more and more rural hospitals are at high financial risk as patients living in the communities choose to go elsewhere for care. COVID-19 has only worsened this situation. Ambulatory and outpatient care facilities were obviously hard hit by social distancing and non-essential business policies. During the last cycle, the situation was quiet compared with what has transpired the past several months. That being said, employment should rebound at a relatively swift pace in most instances, in particular in dental and optometrist practices. Plus, many in this space have benefited from COVID-19 aid. But like other healthcare industries, they may encounter a shortage in medical supplies as many are manufactured in China. Finally, in this table, I yellow flag a few segments as these may have limited coverage under many popular health insurance plans. Employment in social assistance industries is the weakest area of this sector going forward. IBISWorld's industry risk scores red flag the obvious in this table. The cautionary flags are industries dependent on federal government policies and budgets, the vagaries of the November elections. Your guess at this juncture is as good as mine. Let's finish this off with a peek at some miscellaneous industries, many of which IBISWorld clients have been curious about. First, the Information Industry Group, or NAICS 51, and the Management Administrative Waste and Remediation Group, or NAICS 56. This graph plots the broad two-digit information industry group versus the total national unemployment rate. Information, like many other two-digit sectors, follows the national rate closely, with the proviso that it's usually a tad lower. Nonetheless, there are considerable differences if we disentangle, as seen in this table. Take a look at these unemployment rates, May on May, this year versus last, and the differences in the two. Motion picture and sound recording businesses clearly stand out as the nastiest. And here's a detailed riskiest industry list for the information group. Take time to peruse this if you have exposures here. I yellow flagged movie theaters since reopenings might breathe some life into these much maligned businesses, depending, of course, on location and second waves or mini waves of the virus. And here are the relatively safe industries for the information employment category. Green cells here look like the safest to me. And finally, consider the management, administrative, and waste and remediation services group. Always much higher unemployment rates than the national average, so be alert if you are involved in this sector. The core of the problem resides in administration and support, or the NAICS 561 subgroup. Check this figure out. Always grossly higher than the national rate. The current debacle is no exception. And here's the laundry list of risky industries. Note the employment growth rates during the last cycle. Little comfort here. Take some time to investigate these further if you have exposure in these lines of business. Well, that's it for today. Thanks so much for being here. This has been the final episode of the unemployment-focused mini-series. Just another shout out to my IBISWorld colleague Rob Miles for his help on engineering these presentations. There's a lot of work that goes into these, as I'm sure you can imagine. I'll start a new mini-series next week with a slightly different angle on the COVID-19 crisis, so I hope to see you then. Happy Father's Day for all you dads out there. Stay safe and Godspeed.